Treatment is applied. Solution, finding a solution. Treatment is solution, right? So finding a solution, the treatment is applied. Now, how do we diagnose tuberculosis? Is that a basic research question or applied? Applied. We are finding a solution, diagnosis. What is it? How do we diagnose? How do we diagnose COVID-19? How do we screen COVID-19? How do we prevent COVID-19? How do we treat COVID-19? How do we manage COVID-19? All of these are applied questions because they are all related to the treatment, the solution. So whenever you see a research question that is answered in a yes or no, it's basic. But when you see a research question that is answered with a solution, that's applied. Simple. So from now onwards, remember, pure research, fundamental research, basic research is always answered in a yes and no. And applied research is always answered with the solution, the treatment, the management, the prevention, the screening, the diagnosis. Now, if that is the case, now where do we put these kind of questions? What is the risk factor for COVID-19? I cannot answer it as a yes or no. And this risk factor is not telling me the solution. I'm finding a cause. How is COVID-19 caused? What are the risk factors for COVID-19? What is the rate of COVID-19 transmission? What is the mechanism of COVID-19 virus? The coronavirus. What is the mechanism? How coronavirus damages human lung? All of these are the questions you cannot answer as yes and no, and you cannot even answer it as a treatment or solution. So where do we put it? In applied or we put it in basic? Let me tell you, according to my experience, most of my students, when I ask this question, they answer it wrong. They say it's applied. Yes, applied is a wrong answer. Basic is the right answer. So remember, basic is not always, now I'm rephrasing it, basic research is not always yes and no. Yes and no is always basic, but basic research is not always yes and no. What are the causes of COVID-19 or any disease, any problem? How it happened? What is the mechanism of the disease? What are the risk factors, causes, the mechanism? All of these are pathophysiological questions. Questions related to the mechanism or pathophysiology. All of them fit into the basic category. They are exploratory in nature, but we put them in basic research just for the understanding and creating a concept. So basic research is when you have a question whose answer is yes or no, or you're finding a cause, risk factors, mechanism, pathophysiology, how it affects. Applied is always treatment, solution. So applied, you don't change anything with applied. Applied, you always keep treatment, solution. So just remember treatment. Applied is for treatment and solution.